Every 40 seconds, someone in the world dies from suicide. That means that by the end of my introduction, another life will be lost. Behind every statistic is a person, someone's child, someone's friend, someone's coworker, a family member that struggles with pain, pain that can become unbearable, pain that they no longer want to feel. Today, I want to talk to you about an important topic: suicide prevention and awareness. Though this topic is difficult to talk about, it is an important one. My goal today is to inform you of the causes of suicide, the warning signs, the risk factors, and how to prevent suicide. By understanding the warning signs, the risk factor, what causes a person to take their life, we can have a better understanding of how we can help them. According to the Center for Disease Control and Prevention, suicide is one of the main leading causes of death in the world. And you may ask yourself, why do people do it? What are the reasons? One of the main reasons is mental health. Someone that suffers from depression, anxiety, PTSD. Another cause, another reason is trauma. That person has gone through trauma in the past or are currently going through a traumatic event in their life. The feeling of hopelessness, feeling alone, feeling like you're not worth anything. Warning signs you guys should look at is withdrawing from family members, withdrawing from friends, isolating yourself, removing yourself from social gatherings, changes in mood behaviors, anger, feeling hopeless, feeling worthless, emotional signs, like I just stated, anger, sadness. Verbal signs are very important. Someone that states, I no longer want to live. I no longer want to be part of this world. Those are signs we should all take seriously. Some of the risk factors: family history of suicide, previous suicide attempts, abuse, trauma, as stated before. How can we prevent it? Sometimes people don't want to come to you for advice. They just want you to listen. Listen without judgment. Try your best to understand and not judge. Ask. If you see the signs are there, ask them, do you want to take your life? And if they say yes, help them. Encourage them to get the help that they need. Stay connected. Even after you get them that help, keep in touch. Check in on them. See how they're doing. Some of the resources for suicide prevention and awareness is the Suicide Crisis Lifeline. You text or call 988 day or night. The crisis text line. You text home to 741-741, and they will provide you with a counselor or a therapist at that moment to speak to. Schools, your workplace, they have resources. Suicide is preventable. Hope is always possible. We need to be there for one another. We need to see these signs. We need to see the risk factors. We need to be aware of the resources out there for us, for others. So when that person comes to you, you can help them. Do not be part of that stigma of mental health. It's something that we just don't talk about. Be open-minded. Allow yourself to speak to one another about your thoughts, your feelings, regardless of that stigma of mental health, suicide, awareness, and prevention. That alone, being supportive towards one another, can help save somebody that is struggling. Someone that we might not recognize is struggling might see you bring awareness to the community and be comfortable enough to say, I will be okay if I talk to this person. I will be okay if I open up to this person. It's okay not to be okay, as long as we get the help. Thank you.